My name is Dr. Divya Balakrishnan, and I work as a dentist here in Saskatoon. I do a large range of procedures, including fillings, crown and bridge, Invisalign, which is like teeth straightening, as well as we offer cleanings and checkups for new patients. That's kind of what we do on the general aspect of things in our practice. On top of that, I actually own a dental practice, so I wear a couple hats in that. I do some management of staff and also kind of managing schedules and kind of keeping everybody up to date with what the newest things in dentistry are and making sure that we're able to offer the newest and best procedures in dentistry. A typical workday in our dental clinic is when I come in, I usually have two main chairs that I have to worry about. One is my hygiene chair and one would be my treatment chair. My hygiene chair, actually my hygienist would run it and they do the cleanings, and I would have to pop in whenever I have a minute to do the checkup and make sure that everything is okay with that patient's in particular's oral health. My second chair that I run would be the treatment chair. So those are the chairs that I would actually do my fillings, my crowns and bridges, the Invisalign, whatever is actually scheduled for the day for dental needs. So from a young age, I was always very interested in healthcare and being in healthcare in some capacity. It probably started because my dad was a surgeon and my sister is also a surgeon. So I was brought up with a medical sort of background. I went directly from high school to the University of Saskatchewan and pursued my first year in arts and science and learned very quickly that I really enjoyed science, but also the human body. So I ended up pursuing a 4-year Bachelor of Science in Physiology. At this time, I believe it's a Physiology and Pharmacology degree. And from there, when I completed my degree, I applied to actually both medical school and dental school because I knew I wanted to be in healthcare. I was actually waitlisted for medical school, which felt really daunting because that's what I thought I wanted to do, but I was accepted to dentistry with a very significant scholarship, and so I felt like it was the right move at the time, and now I look back and I really believe that there was a reason for why that all happened. Once I entered dental school, it was challenging because I had the physiology and healthcare background and was doing well and even excelling in the medical school classes, but I found dentistry very challenging, but I really enjoyed the hands-on nature of it. We were all in the same boat. Nobody had ever picked up a handpiece or a drill before, so it was very cool to see that progress during dental school. And I'm very happy and honored to be a part of the profession now. Upon completing and convocating dentistry, I actually started working as an associate, so like underneath a group of dentists here in Saskatoon who ran a very, very well-run business, and they taught me a lot and groomed me to want to be an owner, to actually practice on my own and have my own thing. So after associating for 5 years, I ended up purchasing my own clinic. And I actually still am partner at the other clinic as well, so I work in 2 different places. A career in dentistry can be very variable. There can be a dentist, a dental assistant, a dental hygienist. When I was in high school, and even honestly when I was in university, I didn't actually understand the difference between them, and I didn't know what a typical workday looked like. So once I started getting interested in dentistry, I actually reached out to some dental offices to shadow. I was able to go in and actually watch some certain procedures. I also would reach out to try and talk to somebody in the field, but at the same time, I think the main thing is looking into having the proper requirements for your credits and for your university prerequisites and everything like that. As well as looking into requirements like the dental aptitude test exam and interview skills. But the main thing that I can say is try and get a taste for what a dentist actually does by reaching out to one to make sure it's something that you're interested in. The kind of person that I see being a good fit for dentistry, but also like myself, has other things to them. I really enjoy volleyball. I'm an avid golfer. I like to travel, and dentistry allows me to be able to do that. Now, of course, having a science background and having the proper prerequisites and the proper aptitude for those types of classes is important. Being competitive and being up for a challenge. It's a 4-year degree on top of I think you have to do 4 years beforehand. So being open to be in school for up to 8 years, possibly longer. Also, the challenge of something totally new that most people have never had to experience before. But really people that want to help others. That's part of why I do what I do. The days that we have where we get somebody out of pain and they're very thankful, or we help them with an aspect of their smile that they might have been self-conscious about, those are the best days that we have, and that's why we do what we do. So I think somebody who is basically up for the challenge and wants to help others.